Hello beautiful people, you are live on a brand new episode of Ladyz Digest, where issues in the world of women are discussed. And Ladyz Digest is proudly powered by AAU TV, the voice of higher education in Africa. Pelvic organ prolapse is our topic for discussion today, and it is a type of pelvic floor disorder that can affect many women. In fact, about 1/3 of all women are affected by prolapse or similar conditions over their lifetime. After the quick pause, we'll go straight to the discussion. Remember, you can join the conversation on our social media handles at Ladyz Digest on Instagram and Facebook and YouTube at the Association of African Universities. I'll be right back. Welcome back. But before we begin, I want to inform my cherished viewers that the information I will be sharing were gotten from WebMD. So our first question with regards to this topic is simply, what is a pelvic floor disorder? The pelvic floor is a group of muscles that form a kind of hammock across your pelvic opening. Normally, these muscles and the tissues surrounding them keep the pelvic organs in place. And these organs include your bladder, your uterus, your vagina, your small bowel, and your rectum. Sometimes these muscles and tissue develop problems. Some women develop pelvic floor disorders following childbirth and as they age. Conditions associated with the pelvic floor disorder include pelvic organ prolapse, urinary incontinence, and anal incontinence. So our next concern is, what then is pelvic organ prolapse? Prolapse refers to the descending or drooping of organs, and pelvic organ prolapse refers to the prolapse or drooping of any of the pelvic floor organs, including the bladder, the uterus, the vagina, and among others. And these organs are said to prolapse if they descend into or outside the vagina or the anus. So then, we would ask ourselves, what causes this condition, this pelvic organ prolapse? Anything that puts increased pressure in the abdomen can lead to the pelvic organ prolapse. And some common causes include pregnancy, labor, and childbirth. And these are the most common causes. Obesity too can cause disorder. Constipation can also cause this disorder. Pelvic organ cancers, among others, are also causes of this condition. And it is worthy to note at this juncture that genetics may also play a role in the pelvic organ prolapse. So while speaking with a group of women, some women say their symptoms are worse at certain times of the day, during physical activity, or after standing for a long time, and other things. So then we'll ask ourselves, what are the symptoms of pelvic organ prolapse? Some women will notice nothing at all, but others would report symptoms with pelvic prolapse as a feeling of pressure or fullness in the pelvic area, a backache or low in the back, painful intercourse, a feeling that something is falling out of the vagina, that is weird though, constipation, spotting or bleeding from the vagina. So we ask ourselves, with regards to diagnosis, what will my doctor talk to me about? What test or what series of tests will be run? Your doctor may discover pelvic organ prolapse during a routine pelvic exam, such as the one you get when you go for your pap smear. And your doctor may order other variety of tests like the CT scan of the pelvis, the ultrasound of the pelvis, and the MR scan of the pelvis. Okay, so we ask ourselves about the treatment of this condition. Can pelvic organ prolapse be treated? For that, treatment of pelvic organ prolapse depends on how severe the symptoms are. So we are talking about the severity of the symptoms, and treatment can include a variety of therapies, including behavioral treatments, mechanical treatments, and surgical treatments. I don't want to prefer any form of treatment here. For that, I will advise that you go see your physician or you visit your doctor. And we'll move on to the measures that we as women can adapt to work with in order to reduce or prevent this disorder. So many risk factors for pelvic organ are out of your control. However, you can reduce the likelihood of you having the problem by trying the following steps. 1, you do your Kegel exercises daily to maintain good muscle strength in your pelvic area, since it seems everything depends or everything lies on the pelvic area. So you do regular Kegel exercises. You maintain a healthy weight, because one of the causes I said and spoke about early on was obesity. So you try and maintain a healthy weight. You avoid constipation, and you don't smoke. That has to do with your lifestyle, your behavioral prevention. You try as much as possible not to smoke or reduce your smoking, as smoking can affect tissues, and a chronic cough also can cause the risk of the problems. So in conclusion, many women are embarrassed to talk to their doctors about their symptoms or think that their symptoms are normal. But pelvic organ prolapse is treatable. That is one thing we should take out of this. It's very treatable. So as much as possible, I advise every woman out there, if you are having any of the symptoms or you notice any of the symptoms, kindly speak to your physician or your gynecologist and get help immediately. This has been Ladies Digest, and I've been your host, Joan Ikuya. Many thanks to my production team for making this production a success. Till I come your way next time. Bye.